Hello, can
Doc.
you hear me? Hi.
Yeah, we can hear you. So did you watch that match between Denmark and Finland where Christian Eriksen actually collapsed on the pitch?
Yeah, I actually watched replays of it, and it was a really shocking incident.
It was, wasn't it?
was,
So
yeah.
the doctors after that, they said that he suffered actually from cardiac arrest.
So that's actually the thing that is a bit puzzling, because for elite athletes collapsing like this, it's actually quite rare and getting more rare. There've been a lot of spotlight on screening for elite athletes. So to actually see Eriksen actually fall in front of everyone, that was a really shocking thing, because I thought that would probably be the chances of that happening are super rare nowadays. That's what I would think, particularly with all the screening.
But here's another question, and I think that kind of confuses many people, including myself, until I learned about it in depth. But for the benefit of those who don't, Doc, what is the difference between a cardiac arrest and a heart attack?
Heart attacks are caused by disease of the coronary blood vessels, all right? And I've got a model up here to show what coronary blood vessels are. So this is our heart, and it's the size. This is the kind of size that we're looking at. On the surface of this heart, or our hearts, we have lots and lots of blood vessels which carry oxygen, and this is called coronary arteries, all right? These blood vessels. So when we have disease with coronary arteries, and usually this is because of cholesterol, high blood pressure, and so on, this can slowly narrow down and cause problems with the blood supply.
Right.
So a heart attack happens when there's total disruption or severe disruption of this blood supply, to the point that the heart, which is supposed to be receiving lots of oxygen, is suddenly cut off. Okay, and when it cuts off, it will actually slowly die. The muscles actually slowly die. So that's really a heart attack. So a cardiac arrest is a situation where the heart, from any cause, suddenly stops functioning. It stops pumping blood. And this usually is an electrical issue. So what likely happened in Eriksen's case was that the heart suddenly went into a very irregular heart rhythm. It went to very, very fast heart rhythm. And the electrical heart rhythm was so fast until it happened a very inefficient pump. It became a very inefficient pump.
Right.
So it's beating super fast at about 150, 200 times a minute, but there's actually nothing supplying the brain, kind of thing. So that effectively is a cardiac arrest, okay?
So in the event that you're the first responder, all right, so if you're the first responder and somebody in your household collapses, like
or someone near you, for example.
Yeah, or somebody near you. And how do you check to see, what if it is or isn't cardiac arrest? And then what do you do? And what are the next steps that you should do if it is?
When you see somebody collapse, okay, first and foremost, you have to check for signs of life. By checking for first signs of life, what do you do? So you put your fingers on the person's neck, okay, try to feel the major blood vessel pulsating, so that's a carotid pulse. The other signs of life that you can check for is the patient breathing or not. So what you could do is put your ear very close to the patient's face and listen out for movement of air. The other thing you can do is observe the person's chest to see whether or not the chest is rising or falling. So that's really the first step. What you do next, if there's no signs of life, first and foremost, without doing anything else, you must call for help. So what you do, either you shout for help at the top of your lungs, or you call 999 straight away. Okay, tell them where you are, and then you get down to business. So what you have to do, first and foremost, check in their mouth. Is there anything? Have they choked? Is there something obstructing their mouth or passages or whatnot? And just have a look. Sometimes, if it's safe, you might sweep his mouth to try and clear anything out, all right? But sometimes if you're not comfortable, you can leave it. Totally acceptable, all right? You just move on to the next step. So what you do, lay the person on the back. So what you do, you interlock your fingers. So just find the midpoint of the chest, okay? So between the nipples and up down to the sternum, that's where the center of the chest will be, all right? Your heart is really slightly to the left, but it's okay. We just focus on getting pressure on the sternum. So after interlocking your hands and fingers together, you will pump down for about 5 to 6 centimeters down at a rate of 100 beats per minute. So you pump, and you keep going. You keep going until help arrives, okay, or until you become tired.
Okay. Doc, you know what? We've learned so much today. It's been a great education. I mean, especially, it was shocking to the world. I mean, what a shocking start to the Euros. And again, to just bring it back, such a young elite player who is one of the top goal scorers. I mean, he probably runs 100 kilometers a day. You never know, right? These guys
Definitely.
are crazy. And then there he goes dropping what more people like myself or yourself or Aisha or, we're in that age of risk. But thank you for your time. Thank you for
No
educating.
worries.
Doc, we'll definitely be talking to you more often. You are now on our speed dial, also just in case.
Happy to have joined today. Yeah, I'm really happy to kind of offer share some information about this super important topic.
Thanks, Doc.